Good morning, everyone, and welcome back to Wisdom Wednesday. I am your host, Dorothy Dorton, AARP Alabama's Associate State Director for Outreach for Lower Alabama. And before we get started, I just want to wish all of my fellow Lower Alabama residents good luck. Stay safe in the coming storm Zeta. We should be used to it by now, because what else is 2020 going to throw at us, right? So today we're going to be talking about a really important topic, and that is Medicare Open Enrollment. And for most people, this is a really confusing time because it's an extremely important thing. It's all about your health, and there's so many different options out there. And so what do you choose? What's right for you? And so today we're going to be talking about that. And I want to remind everyone to please feel free to ask relevant questions in the comment section, and we'll try to address each of those as either we get to them or at the end of the broadcast. It's also important to know that we are not endorsing any particular Medicare plan or company. We are here to provide resources that empower you to make your very own decisions about your health care. We're also going to be showing you a lot of slides for contact information and useful resources. And so if you miss those or they're not up long enough to write down the information, don't worry. We're going to add those slides into the comments section on the Facebook page after the show. And so today I'm really happy to be joined by James Roberson. And he is the Regional SHIP Coordinator for the South Alabama Regional Planning Commission. And James is going to talk to us about the SHIP program and other statewide resources. And James, I just want to thank you so much for joining us today. Can you tell us what SHIP stands for and what the SHIP program is about?
Sure. First, good morning, and thank you, Dorothy, for giving me the opportunity to speak with you all this morning and as it relates to the SHIP program. The State Health Insurance Assistance Program is actually what SHIP stands for. And basically, in its essence, what it is a free, unbiased Medicare counseling service that has been funded, by the Administration of Community Living. And it's actually administered through the Alabama Department of Senior Services and the Area Agencies on Aging. SHIPs are located in every county of the United States of America. We have roughly about 12 coordinators here in the state of Alabama. I'm responsible for the Mobile, Baldwin, and Escambia County area in the state of Alabama.
Excellent. Thank you so much, James. And I'm putting up some information right now. And this is for Mobile, Baldwin counties and Escambia counties. But for other folks that are in the rest of the state, you can also call 1-800-AGE-LINE or go to alabamaageline.gov. And this is such a wonderful resource for folks in Alabama. And I know some people hearing this are probably really relieved at this point to know that it's available. Can we go back, James, and talk about just basically open enrollment as itself and how long it lasts and really why it's so important for folks to review their plan each year?
Absolutely. Well, SHIPs are designed to assist people during the open enrollment season. You know, there's millions of people on the Medicare program. So every year there's an opportunity to reevaluate your Medicare prescription drug plan and or your Medicare Advantage plan. So with that being said, October 15th through December 7th is that time to reevaluate these plans. So your local SHIP is available to assist you with going over the information that you will receive in the mail and also assist you with finding out what options are best for you as it relates to the upcoming year. So everything that people are getting and seeing in the mail, on television, those kind of things, those things are actually designed to encourage folks to look at the plans for the 2021 year. That'll be effective January 1st.
Great. Thank you. That's great information. And so It is. It's so important. And I know you mentioned this before, but can you tell us a little bit more about how SHIP can help with this review and this decision-making process? Like we said, it's completely unbiased and not endorsing any particular company. So what if someone calls in to SHIP? What can someone help them with if they're asking about their open enrollment questions?
Good deal. Good deal. Well, great question. Well, basically, we're all things Medicare. We're Medicare at a local level. SHIPs were created to provide this counseling resource to people at a local level so they don't have to necessarily dial 1-800-Medicare. Every person in the United States in every county has a local SHIP counselor and coordinator to assist them with their Medicare options. So if someone were to call us, especially this time of year, we would assess their needs. We would ask them about their Medicare prescription drug plan. We would ask them about the pharmacies that they use. We would ask them about the Medicare Advantage plans that are available in the area and kind of find out what their need is. You know, are their medications expensive? Are their premiums high? Are they paying too much in deductibles? How are the networks? You know, a lot of people's networks change. Doctors change networks often. Hospitals change contracts often. Doctors move. People move. So a lot of people during the open enrollment season may have relocated to this area here recently and may need some assistance. So your local SHIP program is designed to kind of help you go through these options so that you can make an informed decision for yourself as it relates to the Medicare program.
That's great. That's so good to know. So it's basically they can call in and somebody can, like you said, assess their needs and see what it will be a good fit for them and talk about, kind of guide them into, well, if these are your needs, this is what you need to look for. So that's great. And like you said, things are always changing. And even, Medicare is always changing. There's always new regulations coming down and how people file and what it covers and what it doesn't cover. So it's like I said, it's so confusing. And so it's so great to know that this is here. So another thing that people struggle with, and you mentioned this, was prescription drug costs. Unfortunately, drug prices are still at an all-time high. And are there resources out there that SHIP can help with drug prices or prescription drugs?
Yes, absolutely. Absolutely. It's really popular this time of year. It's a program called Extra Help, also known as low income subsidy. It's actually administered through the Social Security Administration for people on Medicare Part D, the prescription drug plan component. And basically what Extra Help is a subsidy program to help people pay for their prescriptions. So sometimes people who are taking higher tier drugs, tier 5, tier 4, or specialty drugs, things of that nature, those drugs can be really expensive under a Medicare prescription drug plan. So what we try to do at the State Health Insurance Assistance Program is to screen every call, everyone that we speak to, we screen to check their eligibility for this program. So the monthly incomes for that program are on the screen, and they are $1,615 for a single person, and it's actually around $2,175 instead of $2,170 for a two-person household or married couple. And these incomes go up each year. But what that does is, if a person qualifies for this program and assets, and resources are counted, if a person qualifies for the Extra Help program, their medication costs are immediately downsized to roughly $3 and change or so for generic drugs and around $8 and change for brand name drugs. So that's a significant difference for people. Some people are taking medications that may cost $100, $200. We've seen people that have medications that are $500, $600 a month for one medication, one prescription. Extra Help can help these people pay for those drugs at a relatively low rate to assist them with filling all of their prescriptions.
That's a great program. That's so good to know. And I know that's some great information to get out to folks, and that is statewide. So
Absolutely.
again, please, I'm going to put this number back up here, 1-800-AGE-LINE, alabamaageline.gov. Go online, give them a call, ask about SHIP, ask about the prescription drugs. Another thing that I wanted to talk about real quick was the Medicare savings.
Mhm.
And the Medicare savings program. I know you already mentioned this, but this had some different income limits and stuff. Can you talk a little bit about what this is and how it can help?
Sure, sure, absolutely. The Medicare Savings Program is actually formed through Medicaid. It's actually a Medicaid program. It will vary in
Okay.
some cases state to state, but what it does is it pays the Medicare Part B premium for people who meet the income limits here. And what that means is as you go into Medicare, Medicare Part A is typically premium free. We don't pay a monthly premium on that because we pay what's called Federal Insurance Contribution Act, FICA taxes throughout our working careers. So typically Part A is premium free. Medicare Part B, we all have to pay a premium, monthly premium for that service. And basically what it is a roughly $144 a month at the moment. Well, what happens is if you're eligible for Medicare savings, the state Medicaid office will pay that $144 Part B premium for you. So in essence, that money goes back into your check. So there's a lot of people that are eligible for it. The monthly income, as you see on the screen, is $1,456 a month for a single person. And for a married couple, it's $1,960 a month. And basically what it does is it puts money back into people's pockets. You know, a lot of people don't know that they don't automatically put you in or enroll you on these programs. You have to apply, and your local SHIP office can help you apply to save money monthly.
That is great. And a lot of people who obviously qualify for Medicare are on these fixed incomes. So this
Absolutely.
is just such a wonderful resource to have and such a good thing to let people know about. I really appreciate it, James. And this is
Mhm.
just such great information. Now, unfortunately, with things like Medicare Open Enrollment, we always know that there are scams out there and fraud surrounding it. Can you tell us a little bit about maybe some of the scams, the frauds out there to look out for, and maybe what we can help do to prevent Medicare fraud and things like that?
Yeah, great question, Dorothy. Well, to begin, I'll talk about some of the things you can do first to kind of protect yourself. And one of those is the most important thing you can do is to pay attention to what's called your Medicare summary notice or your explanation of benefits. What that basically is a report on everything that's been mailed or excuse me, billed to your account. So if you go to the doctor, if you pick up prescriptions, whatever you're doing, if you have a procedure, an outpatient procedure, if you have a specialist visit, what happens is if you're on original Medicare, it's going to come in the mail through what's called the Medicare summary notice, as you see on the screen. If you're on a Medicare Advantage plan through one of the private contractors, Blue Cross, Humana, Health Springs, Cigna, United Healthcare, those type of programs, it's going to come in what's called explanation of benefits. And what you want to do with that is you want to make sure, look at that and see if you actually did what's on that report. Were you there? Did you go to that doctor? Did you go? Did you were you treated on that date? Most people keep a calendar of some sort, kind of know when they've been to the doctor. If you see a discrepancy, first thing we ask you to do is contact the doctor's office. Sometimes it could be an error. It could honestly be an error. Most of the
Right.
time, that's the case. But in some cases, actually could be a abuse or fraud situation where someone, you may have never been to that doctor, you may have never received that service or a piece of equipment. Medical equipment is always an issue for people.
Hmm.
Sometimes people see these things and they may have a wheelchair or CPAP machine that they've never received. And that
Right.
all really costs all of us a bunch of money as it relates to Medicare. So what we ask people to do is check their summary notice. If you see a
Hmm.
discrepancy, check with that provider, and also contact us, and we can get that reported for you. Telehealth
Excellent.
right now, telehealth is an issue as far as something to
Hmm.
look out for or trends. You have to make sure that you're speaking to the correct physicians. Make sure you contact your doctors directly so that you don't get scammed. Don't give out information on inbound calls. When people call you, don't give out anything like your Medicare number or your Social Security number or those type of things. Those are just simple ways you can protect yourself during this time, especially now due to COVID. There's a lot of people that are taking advantage of the internet and trying to scam
Hmm.
people out of their information and services. So just if you're questioning, always just give us a call, check with us. We'll be glad to assist you to verify it.
That's great information. Thank you so much, James. Again, I'm going to be popping up contact information, 1-800-AGE line. This is for the whole state of Alabama. So while James is down here in Mobile with me, if you're in Huntsville or Birmingham or Montgomery or anywhere in Alabama, you can call 1-800-AGE line and get in touch with a SHIP representative, SHIP coordinator that can help you with these types of questions and issues. And James, I'm so glad you talked about the fraud issue and especially the medical equipment. We actually did a fraud teletown hall last week, and a lady called in and mentioned about how she was receiving medical equipment that she didn't need and then was getting billed for it and kind of all of this craziness. So that is definitely something to look out for. So I appreciate you definitely mentioning that. We did have one question in the comments, and it was, and I'm assuming this is for some of the income-based programs, but will the dollar change based on the recent announcement about the cost of living increase?
Yes.
Do you know? Okay.
Yes, it will. It does. Those income limits change yearly. So around February normally is when we see the 2021 income limits. What was on the screen were actually 2020 limits. But what's going to happen in February is because of the cost of living adjustments, those numbers will also rise to meet the needs for people. So we normally like to get it a little higher than what cost of living was or is, so that we can catch more people. So sometimes people who weren't eligible this year may be eligible in 2021. So yes, that's a great question. It will, the limits will increase.
Okay, that's great to know. And I know we actually talked about that off screen, and maybe having you back on for Wisdom Wednesday, maybe in February or March, to talk about what the cost of living increase is, so people can kind of plan and expect for that. So we'd love to have you back if you're willing to do that with us, and to let people know and spread the word about that, because it's, if anybody's like me, I'm a planner, so I like to know about these things well ahead of time. So James, I want to again thank you so much for joining us today. This is again such an important thing that people need to know about, and the resources that you provide with SHIP are so great. I'm going to pop them up here again just so people can see. And again, folks, we will put these in the comment section on the Facebook page, so you can see these without having to go back and watch everything, even though we don't mind you doing that. But I do want to make it easy for people to get this information, because it is so important. And I really think that there's a lot of people who don't know about this. And so we really need to get the word out. And, especially like you said, with the pandemic and everything, things are just so confusing. And, as we can see, technology is great, but it's also got its pros and cons. And so we want to make sure that people are getting the right information, that they're, like you said, not giving out information over the phone or online through emails or anything like that they don't need to be giving, like their Medicare number or their Social Security number, things like that. You never want to give those out to anyone that you don't know for sure. So again, James, I just want to thank you again for joining us. And let's see, we do have one more question. This is a great question. Will SHIP counselors help you compare plans? So if someone calls and has two plans to decide from?
Yeah, we're actually doing that now. That's what we're doing during the open enrollment season here locally, really all across the country. SHIPs all across the country. Anybody who has Medicare, that has a prescription drug plan or a Medicare Advantage plan, this is the time of year to contact your local SHIP office to find out if the plan that you have will be compatible or better than the current plan, the plans that will come out in 2021. These are all done free. Your SHIP service
Mm-hmm.
is a federal program, which means it's tax fund. I mean, your tax dollars pay for this service. It's a free service. We're not affiliated with any particular insurance plan. Our job is to make sure that you have a fundamental understanding of what's ahead of you. Basically, risk management. That's kind of where we are with this. We want to make sure that you know where the pitfalls are and that we can help you get around those to get what you need so that your health insurance works. So absolutely, we can help people compare plans, and we encourage people to give the local SHIPs a call.
That's great. And just to reiterate maybe again, even though there are some programs that are income based, calling SHIP and asking this information is not income based. It's free for anybody who needs help making these decisions. Is that correct?
Yes, that's a great point, Dorothy. A lot of people assume that it's some type of income-based situation to receive assistance, and that is totally not the case. We help everybody that has Medicare or that's going into Medicare. We help caregivers of loved ones. Some people are helping their mother, their father, or a relative, or the neighbor down the street. We help anyone who has questions about Medicare. So it's not an income-based situation. Now, those other programs, some people do qualify for extra help or Medicare savings based on their income. But our counseling service for SHIP is for everybody, regardless. So we want to make sure that people understand that we are here, we are available, even through these times. We're unfortunately not able to be face-to-face as we have been for the last 30 years or so. Right now, most of the SHIPs are working independently, maybe even at home. But we're able to work from our remote locations to provide the same services that we've been providing for years.
That's such great information, James. I thank you so much for that. And again, this program, SHIP, is for anyone in the state of Alabama who has questions about Medicare. Like you said, loved ones, of caregivers. If you have questions about it, please contact your local SHIP office. Get those questions that you have answered. And who knows, you or your loved one may actually qualify for some of this assistance. And one more good question. What is the age someone should apply for Medicare?
Okay, well, that depends. Sometimes the official age is 65. If you're 65 years old, you can't get Medicare. You're going to only get it two ways. You're either going to be aged in, which means you've turned 65 years old and worked enough credits through Social Security, or you can be deemed disabled through Social Security, meaning you can be under 65 and apply for Medicare based on a disability. Okay, so it's a very distinct group of people. You can either age in at 65, or you can be under 65 and be on Medicare due to disability. So those are the only two groups.
Okay, that's good.
Will allow you in. Absolutely. So if you're not 65 or you're not disabled, you're not entitled to the benefit until one of the two occurs.
Okay. That's great information to know. So thank you so much, James. And thank you, Tawana, for that great question. Well, I think that about wraps it up. James, I want to thank you again so much for joining us today and providing all of this really great information. And as you were talking about, like you said, even caregivers can call in and ask about their loved ones, which is a perfect segue because next week on Wisdom Wednesday, we're going to be talking about caregiving resources. So to honor the National Caregiver Month, which is November. James, again, thank you so much for joining us. We really do appreciate it. Folks, I am going to put all of these slides into the comments on Facebook, so you'll have all of this great information. Again, I want to tell everybody a last one for a long time. And I am going to show a quick video like I usually do of our upcoming events. And again, stay safe, stay healthy, folks, and stay wise. Thank you, James.
Thank you, Dorothy. Thanks for giving me the opportunity today.
We appreciate it.
All right.